Do you remember that time when connecting health and the internet felt, well, really new, maybe even a bit sci-fi?
Oh, absolutely. It's so normal now, isn't it? But yeah, there was definitely a point where bringing healthcare online felt like this massive shift.
Totally. And right in that early internet wave, this term popped up everywhere, e-health. But what did it actually mean back then? Was it just, websites?
That's exactly what we're getting into today.
Mhm.
We're looking at this really fascinating source. It's an editorial from the Journal of Medical Internet Research way back in 2001.
2001, wow, that feels like a lifetime ago in internet years. Okay, so the piece is called What is eHealth by Gunther Eisenbach.
Right. And our mission here is to really unpack what that buzzword meant over 2 decades ago, why everyone was talking about it, and maybe uncover some surprisingly relevant insights from back then that still echo today.
Yeah, looking at the roots of something that's just, whoa, how we do things now.
So let's dig in. The source points out right off the bat that e-health didn't really start in academia.
Oh, where'd it come from then?
It mostly came from in industry, marketing folks, business leaders, around 1999 or so.
Ah, so it's kind of riding that whole e-commerce, e-business wave.
Exactly, all that energy around digital stuff. Companies wanted to show healthcare was part of that big change, too. The source even mentions Intel seeing it as this big effort by tech and healthcare leaders working together.
Okay, so they saw the potential, but what new things did the internet actually bring to the table compared to, say, older health IT systems?
Well, the source really highlights 3 key shifts in interaction that the internet enabled.
Okay, like what?
First, consumers interacting directly with systems. People looking up health info online themselves, what we now call B2C, business to consumer.
Right, patients going straight to the source online. Makes sense.
Then there was the potential for much easier data exchange between health institutions. Think hospitals, labs, clinics sharing info.
The B2B side, getting rid of the paper trail, hopefully.
Yeah, making things smoother. And the third one, which was maybe the most novel then, was consumers talking directly to each other. C2C.
Oh, like online patient forums or support groups?
Precisely that. People connecting peer-to-peer, sharing experiences outside the official doctor's visit. Seems obvious now, but back then, that was a really big deal.
It's amazing, really. Booking appointments, looking up symptoms, finding communities online. These core ideas were there right at the start.
They were. And this buzz, this industry term, it quickly forced its way into scientific conversations.
Yeah.
The source mentions there was even a debate inside the journal itself.
Really? About using the term?
Yeah, one board member apparently felt e-health should just stay in marketing speak. But it's too late. It was already showing up in Medline and research papers.
The horse had bolted, so to speak.
Pretty much. And another board member made a great point, quoted in the source trying to pin down e-health, was a bit like trying to define the internet. It was always moving, always evolving, best understood by what it did.
So how did Eisenbach, the author of this editorial, actually try to define it then?
Well, he gave a definition with 2 parts. The core technical bit was, e-health is an emerging field in the intersection of medical informatics, public health, and business, referring to health services and information delivered or enhanced through the internet and related technologies.
Okay, covers the basics, internet, tech, health services, info, but you said 2 parts.
Right. He argued it was much bigger than just the tech.
Yeah.
In a broader sense, he said e-health was a state of mind, a way of thinking, an attitude, and a commitment for networked global thinking
Wow.
to improve healthcare locally, regionally, and worldwide by using information and communication technology.
So even back in 2001, the vision was huge. It wasn't just about websites. It was about a fundamental shift in thinking, global, collaborative.
Exactly. A whole new approach enabled by tech.
Okay, this is where it gets really interesting, I think. Eisenbach argued the E wasn't just electronic. It stood for a whole bunch of other E's.
Yes. He laid out 10 key ones, plus a few extras, that really capture the vision.
Let's go through them. What was first on his list?
Efficiency. That was a big one. The hope was, lower costs
Wow.
by better communication between hospitals and clinics, reducing duplicated tests, that sort of thing. And also by getting patients more involved, maybe streamlining things,
Makes sense. Use tech to cut waste. What came after efficiency?
enhancing quality. So not just cheaper care, but better care.
How would that work?
The source suggested things like making data on provider quality available so people could compare, using patients themselves, now more informed, as a kind of quality check, and directing people towards the best care options.
Okay, transparency driving improvement, then evidence-based.
Crucial point. He really stresses e-health stuff shouldn't just be rolled out because it sounds cool. It needs proof.
Needs the science to back it up.
Exactly. Rigorous evaluation to show it actually works and is efficient. And he noted back then, in 2001, that much more research was needed there.
A good reminder even today. What about the individual, the patient?
That brings us to empowerment. Giving people access. Access to medical knowledge, access potentially to their own health records online.
Right, like seeing your test results now, that feels very empowering.
Totally. The idea was enabling truly patient-centered medicine, letting people make informed choices.
And that leads nicely into the next one.
Encouragement. The idea was that this empowerment fosters a new kind of relationship, a partnership between the patient and the doctor, making decisions together.
Less top-down, more collaboration. Got it. So we have efficiency, quality, evidence, empowerment, encouragement. What's next?
Education. Using the internet for learning for doctors, think continuing medical education online, and for consumers, access to health info, maybe even personalized prevention tips.
Spreading knowledge digitally.
Yes.
Okay. How about the systems talking to each other?
That's enabling. Basically, the tech side of making information exchange smooth and standardized between different healthcare places. The B2B part we mentioned.
The plumbing that makes it all work. And extending? Sounds interesting.
Yeah, this was about pushing healthcare beyond its usual borders, geographically, conceptually.
How so?
The source talked about people getting health services online from providers anywhere, potentially. Getting advice, maybe even. Getting prescriptions online.
Wow. They were talking about telehealth concepts back in 2001. That's really looking ahead.
It really was. Shows how foundational some of these ideas were, even then.
Okay.
Nearly there. The last two big ones.
Ethics and equity. Big topics.
Huge. The source flagged that the internet brought totally new ethical questions. How do online consultations work? What about informed consent digitally? Privacy, fairness.
All things we're still debating intensely today. And equity.
This was framed as both a massive opportunity and a serious risk.
How so?
The hope was e-health could make care more equitable, reaching more people. But the threat, and they were really clear on this, was deepening the gap for those without access, skills, or money. The digital divide.
That term was already prominent then.
Absolutely. And the source specifically listed the divides. Rural versus urban, rich versus poor, young versus old, even male versus female, and neglected diseases versus common ones. It explicitly said political action was needed to ensure equity.
That feels incredibly relevant. We're still wrestling with that digital divide constantly.
We absolutely are. Some challenges are just deeply embedded when tech meets society, aren't they?
Definitely. Okay, so those were the 10 main E's. Weren't there bonus ones too?
Yes. A few extras. It also needed to be easy to use. Makes sense.
Crucial for adoption.
And entertaining because, as Eisenbach put it, no one will use something that is boring and exciting.
Good points. Usability and engagement matter.
And the final, very practical one. It needed to actually exist.
Can't argue with that. So looking back at that whole list from 2001, efficiency, enhancing quality, evidence-based, empowerment, encouragement, education, enabling, extending, ethics, equity, plus the others. It's kind of amazing how many are still central to health tech today.
It really is. It shows how comprehensive that early vision was.
Yeah.
I mean, we've made huge progress on enabling data flow, on online education, extending care via telehealth.
And empowerment, getting access to our own data, that's changed things for many.
Definitely. But like we said, those challenges around equity, around ethics, they haven't vanished. They've just evolved as the tech got more complex.
Yeah. So reflecting on these E's from way back helps understand where we are now, doesn't it?
It really does. It provides a great framework.
So this deep dive into a 2001 definition really hammers home that e-health was never just about the wires and websites. From the get-go, it was seen as this big movement, aiming to improve healthcare through efficiency, quality, empowering people, connecting systems, but also being really aware of those big ethical and equity issues.
And the source itself predicted the definition would keep changing, which it obviously has. Thinking about everything since 2001, smartphones, AI, wearables.
Yeah.
Maybe the final thought for you listening is this. What are the new E's? The new fundamental principles we should be thinking about for the future of health and technology. Things they couldn't have even imagined back then.